Yes, good evening, all of you. Am I audible? Am I audible? Yes, good evening, all.
You will get high quality stuff.
Yes, Tippeswamy, KP. Yes, Tippeswamy, am I audible? Am I audible, all of you? KP. Yes, hi, hello, everyone. So, one short session today. 10 most expected long essays. So, that can be asked in your RGUHS paper 1. Say hi, hello, everyone. Hi, all of you. Say hi in the group. So 20, 21st, 22nd, and 23rd. So there are 4 days. The 4 days for your upcoming exam. Yes, Arvind, then how is your preparation? Arvind, then how is your preparation? Tippeswamy KP, how is your preparation going on? Hello, Nazba Tanya, how is your preparation? I can understand the amount of stress, the amount of anxiety in your mind right now because the question paper pattern has been changed from your batch. So it is a difficult moment, I can understand. So and today we are going to discuss 10 most expected long essays in anatomy paper 1. As you know, previously they used to ask 2 long essay. Now they reduce it to one long essay, and I think there will be 11 short essays around 55 marks, and there will be reasoning questions, and there will be 20 MCQs, as you know we discussed in the last class. Yes. Okay, Nazba Tanya, don't worry. You don't worry. Everybody is in the same stress and the same boat. You don't worry. Revise, and prepare some notes, important diagrams, important flow charts, and don't leave any questions in the exam. Don't leave any question. Write something and come. Okay. Yes, Tippeswamy, Nazba. Yes. Shall we start? Shall we start? Are you there? Are you there? Shall we start, guys? So 4 days. So today I'm conducting one session, and tomorrow I'm conducting one more session. 10 most expected long essays that can be asked in your RGUHS exam. So as you know, I am Dr. Manjunath, popularly known as FMT Guru, and author of Solved Papers of Anatomy, Physio and Biochemistry, and also the second year subjects. So right now working as a faculty in Subbaya Medical College, Shumoga. So yes, let's start. Nazba Tanya. Let's start. So briefly we are going to discuss 10 important questions. 10 important questions that can be asked in your upcoming RGUHS exam. Come on guys, okay? So after the class, you just go through these topics, just prepare some notes, some diagrams and revise and you sleep, okay? Yes, let's start with the first question. So that is repeatedly asked in the exam, something like this. Okay, the question can be asked like this. A case of trauma, a case of trauma, and where there is a loss of rounded contour of the deltoid. Rounded contour of the deltoid, you can see here, rounded contour of the deltoid. Yes. So like this, the question can be asked, clinical question. The history of trauma and the loss of rounded contour, and the question can be asked, what is the nerve that can be damaged? So can anyone identify what is the question probably the examiner is asking by giving the history like this? Trauma and loss of rounded contour, there can be history given, that is damage to the axillary nerve. So what would be the question? What would be the question probably? So it is something related to dislocation. So anterior dislocation, posterior dislocation, superior inferior dislocation. So one very commonly asked topic is from your upper limb, that is your shoulder joint. Okay, so this is the question. Can anyone answer? What is the answer for this? Yes, shoulder joint. Very good. Shoulder joint is one very important question and very simple question. So how they are asking question? So they are going to ask question like this. Describe the shoulder joint. So describe the shoulder joint under following headings: the type of joint and articular surfaces, ligaments and the movements. Ligaments, movements and muscle causing them, and applied anatomy. So this is how the question can be asked, and very important question. Remember, so there are movements and you need to write about the muscles causing it. So I think I'm showing one movement here. Can anyone identify what is this movement known as? What is this movement known as? What is this movement? What is this movement? Okay, so very simple question. So what, there will be one question, there will be one long essay. Yeah, as I said, so there will be history given and they will ask you to explain all this. Okay, yeah. Yes, cases I agree, cases I agree. As I said in the beginning, so this is how the case can be given, like this. The case can be given like this. A adult male came with a history of trauma. There is a loss of rounded contour of the deltoid and other features, and what is the probable diagnosis, and explain the joint in detail. So this is how the question can be framed. What you need to write in the exam, so you need to write all these points in the exam. Okay, so type of joint, all these things. Can anyone answer what is the applied anatomy of shoulder joint? Applied anatomy of shoulder joint, briefly. Come on guys. So 1 or 2 minutes for each question. I'm not going to discuss in detail about it, just briefly I'm going to discuss how they're going to ask question and what you need to write. Yes, come on guys. Applied anatomy, you need to write about the dislocation. You can write about the frozen shoulder. Okay, dislocation. So in dislocation, you can explain about the anterior, posterior, inferior, whatever that is, and you can write about the frozen shoulder, or painful arc syndrome, So that can be asked. Okay, painful arc syndrome. Painful arc syndrome. Yes, come on. Okay, this is the one very important question. I'm not going to discuss in detail about it. So after the after this, you just go through the standard textbook and okay, read about type of joint, all very simple: articular surfaces, ligaments, movements and all. So flexion, extension, adduction, abduction, circumduction, all this you must be knowing, and muscles causing it. Okay, and you need to write about applied anatomy. And all of you please remember, so there are three important findings. One is the One is the shoulder dislocation, the second one is the frozen shoulder, the third one is the painful arc syndrome. Yes, this completes the one question. Yes. Second question. Second question, the question can be given like this. Okay, the question can be given like this. So, a case of carcinoma of tongue, a case of carcinoma of tongue, history of tobacco intake, and other findings will be given. The question can be asked about lymphatic drainage and the lymphatic drainage and muscles of the tongue and upper anatomy, that can be asked. So, tongue is very important question, very commonly asked in the exam. Can anyone answer what is the nerve supply of anterior two-third of the tongue? Yes. So Nazba Tanya. So the second question can be asked about the tongue. Tongue is very important question. Can anyone answer? Can anyone answer what is the nerve supply of anterior two-third of the tongue? Very commonly asked. So anterior two-third, posterior one-third, very frequently asked. So nerve supply and related reasoning questions very commonly asked. As you know, taste sensation by chorda tympani now, and the general sensation by the lingual nerve in the anterior two-third, and posterior one-third it is the glossopharyngeal now. Posterior most is the vagus now. So you must be knowing that. Okay. Yes, this is very important question, guys. Very important question. Yes, very good. Yashas and Hari Prasad. Excellent answer. So lingual now is for general sensation, and for chorda tympani that is the taste sensation, and the posterior one-third basically that is the glossopharyngeal now. So the question can be asked about the tongue, guys. You just go through the muscles. What are the intrinsic muscle? What are the extrinsic muscle? What is the nerve supply and the upper anatomy? Very important long essay. Can anyone tell me what is the safety muscle of tongue? Which is known as safety muscle of tongue? Let's see. One who answer will get 3D chocolate from me. Yes, Yashas. Which is known as safety muscle of tongue. Come on. Safety muscle of tongue. RGUHS. Okay. Okay. Can anyone answer, guys? Let's see. Come on, guys. Come on. So good. All are answering. That's great. RGUHS, no beta. Cyan, no, it is not RGUHS. Harsha are very good. Harsha are excellent answer. Yes, I'm going to write the name of the student. Harsha, very good. Harsha, excellent answer. He said, sir, it is the Genio glasses. Very good. So second question, all of you, as usual, tongue is a very important. The first one I said shoulder joint, pakka question. Either it can be a 5 marks question or it can be a 10 marks question. There will be clue for sure, you don't worry. Okay, so this completes the second question. Now third question, third important question. So, and before that, so this is the question asked in RGUHS in your RS6 and RS5. So a person aged about 65-year-old came with the hospital with the complaints of bleeding from thick large ulcer. So the question can be asked, thick large ulcer on the side of the tongue which is present since 1 year and not responding to any antibiotic. So it is a chronic condition and it's probably a cancer of the tongue. So what is the lymphatic, what is the drainage, and what are the presenting parts, what are the muscles, and what is the nerve supply of tongue? Very important question. So very important question. So today after the after the class, go through this topic and everything about the presenting parts, what are intrinsic muscle, what are extrinsic muscle, and nerve supply, and also the applied aspects and the mode of spread of tongue cancer. So it can be blood spread, it can be lymphatic spread. Good answer. Chalo. So second question about tongue, that is okay. And third question, let's see how the question can be asked. So now third question, all of you concentrate. You saw okay. So look at this. Now the question can be framed like this: a 50-year-old with a history of sweating, anginal pain, ST segment elevation, trophonins are present, something like that. The question can be asked about what is the most probable diagnosis and what is the common artery involved. So what would be the correct answer? Hari Prasad, Sayan Mondal. Yes, what is the probable question, guys? So what is the probable question like this? Pain, sweating, involving LAD, left anti-descending artery. The commonest vessel is LAD, that is known as widow artery. So can anyone tell me what is the probable question? Yes. So the one question I think, so there will be a clinical scenario about the MI, myocardial infarction. Okay. So that is sweating, anginal pain and all. Then they can ask you blood supply of heart. That is the coronary arteries, right and left coronary arteries. And also the question can be asked about dominance of the coronary artery supply. That can be asked. Okay, good. Yes, Abhi Wagmer and others. Can anyone answer what is the very important biochemical marker of MI? Biochemical serum marker of MI. It is a biochemistry question. Can anyone answer? Recently asked in the exam. What is the biochemical marker? So let's see who is going to answer. Let's see. Come on, guys. Come on. So first question, pakka shoulder. Second question, tongue. Third question, all of you, this is the clinical scenario like this, a pain, precordial region. So yes, CKMB, no beta. So Pandu, Tanai, no, it is not CKMB. So some student answered, Bhima answered, troponin I. Excellent. So Bhima, very good answer. So Bhima said it is the troponin I. Troponin I is the correct answer. So remember, so troponin I is very important. How to remember? I for important marker of MI. So very good. So good answer, Bhima. Good. Keep going. Troponin I, excellent. Karthik, very good answer. Karthik, Sayan Mandal, very good. All answering great. So chalo. So after the class, go through the coronary circulation and venous drainage of heart, especially coronary sinus. Almost 10 times this question asked, coronary sinus and what are the tributaries of coronary sinus. Can anyone answer what are the tributaries of coronary sinus? One vein which opens into coronary sinus. Come on, guys. Come on. Yes. Come on, guys. I'm there here. I'm just watching you. Come on. What is the one vein which opens into coronary sinus? Let's see who is going to answer. Great cardiac vein. Arvind then, very good. Arvind then said it's a great cardiac vein, middle cardiac vein, hai na? Very good answer. So the question can be asked like this. See, like this the question can be asked. A person was brought with a severe chest pain. Again, one more question asked. So what is the anatomical basis of chest pain? Why do it occur over the left shoulder, left forearm? Referred pain. So remember, this can be a reasoning question. Referred pain of anginal pain or MI pain can be a question in your exam. Okay. So then sweating. So why there is a sweating? So sweating is because of activation of sympathetic system. Whenever there is an emergency, there will be activation of sympathetic system. Because of that, there will be sweating. 20 minutes. Coronary angiogram shows 90% blockage. 90% blockage in left anterior descending artery, which is the commonest artery. Okay. Then the question can be asked, describe the origin, branches and area distribution of left coronary artery. So in one of the exam, the question was about right coronary artery, and in this year exam probably it is left coronary artery that can be asked. And also coronary dominance of the heart and venous drainage of heart. So all of you remember LAD is known as widow artery. So I'm going to write here. All of you write in the chat box. LAD is equal to widow artery. Widow. So आपको पता होगा widow or विधवा artery, that is nothing but LAD. That is the common artery to be occlused in case of sudden death due to MI. So I'll write in the chat box. So LAD is equal to widow artery. Write this in chat box. Keep writing. Bhima, Abhi Wagmore, skull crusher. Just write in the chat box so that you can keep me awake and you can keep yourself awake in the class. Yes, come on, guys. Come on. Try. Keep writing few points. You don't worry. Okay, be confident. So keep writing. Widow artery is equal to LAD. LAD is equal to widow artery. One time writing is equal to 10 time reading. Good answer. So the one important question, the third important question, according to me, it is probably that is the MI presentation and the related question. Okay. Yes, come on. Widow artery. So Bhima, very good. LAD is equal to widow artery. Vidava artery. Vidava. Okay, I must be knowing Puneet Rajkumar death. Okay, Puneet Rajkumar, one of the famous actor in Kannada industry, he died due to sudden MI. So the artery probably which is blocked is, that is LAD. Can anyone tell me what is the ECG finding in MI? What is the ECG finding in MI? बताओ जल्दी बताओ. What is the ECG finding in MI? Physiology question basically. Physiology. Try. Elevated J point. Okay, Bhima, very good. Elevated J point. Yes, Arvind then, very good. Arvind sir, Arvind, he said, sir, ST segment elevation. Yes, I wanted the answer. ST segment elevation. Very good. ST segment elevation. So ST segment elevation, that is a very important finding. So whenever there is ST segment elevation, there will be involvement of myocardium. So myocardium, that is a very important muscle of the heart. When it is damaged, there will be death. There will be necrosis. Very good. Good, Arvind. Good. Chalo. Then the fourth important question. So can anyone guess what is the fourth important question as per me? And I'm going to give a clinical scenario here. Look at this, a 40 or 50-year-old came with a history of some enlargement in the midline, so which moves with a deglutition. So what would be the answer probably? Okay. So yes, come on guys. Goiter, yes. Thyroid, Bhima, very good. Thyroid is very important. So thyroid is very important question. Thyroid, so as you said, it can be goiter. Yes, goiter, that can be clinical scenario. Good. So goiter, or either it can be multinodular goiter or simple goiter, or sometimes 60-year-old and all, it can be thyroid carcinoma. So thyroid carcinoma also can be asked. Thyroid carcinoma. Okay, thyroid carcinoma. Thyroid carcinoma. So goiter, multinodular goiter, yes. Blood supply, the venous drainage of thyroid gland, very commonly asked. And in physiology, it is a very important question, especially hypothyroidism and hyperthyroidism. Very important question. Hypo and hyper. Can anyone tell me what is the biochemical changes or biochemical marker of hypothyroidism? Hypothyroidism. Come on, guys. Hypothyroidism. So guys, in anatomy, very important question is the thyroid gland. So almost repeated 5 times in last 5 years. So thyroid can be a pakka long essay, or it can be short essay as well. Yes, Virendra Patil and Sayan Mondal. TSH, what happens to TSH? Sayan Mondal, what happens to TSH in hypothyroidism? So there will be what? There will be increased TSH and decreased T3 and T4. So decrease T3 and T4. Okay, very important question. So all of you concentrate, guys. So in hypothyroidism, there will be increased TSH, thyroid stimulating hormone, decrease in T3, T4. This can be question in biochemistry and physiology. And in hyperthyroidism, there will be decreased TSH and ulta, that is increased T3 and T4. Hypo and hyperthyroidism, you can write in anatomy as well, you can write in biochemistry as well, you can write in physiology as well. Very important question. Thyroid, guys, very important question. Okay. So the question can be asked like this. Write in detail about thyroid gland, presenting parts, coverings, relations, blood supply, and applied aspects of thyroid gland. So this is how the question can be asked in your exam. Question can be framed. Yes. Okay. So chalo, this is about the question number 4. Question number 4. Good. High TSH and decreased T3, T4. Good answer. Abhi Wagmore, Medico, very good. Chalo, next question, next clinical scenario. Chalo, dekhte hain next clinical scenario. This is my favorite question, guys. This is my favorite question. What is this condition? What is this condition, guys? Can anyone tell me? A child came with a history of deformity of upper limb like this, which is also known as policeman tip hand. Policeman tip hand, hai na? So what is this known as? Okay. Yes, Hari Prasad, very good. Hari Prasad answered correctly. So Hari Prasad said, sir, it is Erup palsy. Erup palsy. Good answer. Erup palsy. And the question can be asked about the brachial flexures. Okay, brachial flexures, very important question. So the question is very simple question, brachial flexures. You need to write about the Erup paralysis, Klumpke paralysis and all you can write in the exam. You can write the causes as well, how the limb appears in Erup paralysis, how the limb appears in Klumpke paralysis. That can be asked very commonly in your exam. Okay, remember Erup paralysis, the policeman tip hand, a waiter tip hand. Klumpke paralysis, there will be claw hand. Remember, claw hand that occurs in case of Klumpke paralysis. Good. So brachial flexures, very important question. So in brachial flexures, what you need to know, that is the formation that everybody will write. Parts though very easy. The relations, okay, sometimes the question can be asked about the relations. So concentrate on this. So this can be difficult question, the difficult part of the question, relations. Okay, relations. Then the branches and all. Then the question can be asked about winging of scapula. Winging of scapula. Very important question. Can anyone tell me what is the nerve affected in winging of scapula? Winging of scapula. Come on, guys. Come on, guys. Come on. Bhima, Arvind, Sayan Mandal, Sahil. Arvind then. Very good. Arvind, excellent answer. Arvind, excellent answer. You are great. So he is telling, sir, long thoracic now. Okay, long thoracic now, that is nerve to serratus anterior, right? So very good. Hari Prasad, Manish, excellent answer. So this can be asked in your exam. So I'll just revise. So first question I said that is all brachial flexures and thyroid gland tongue and all. Fifth question. Now sixth question. Chalo, sixth question. Sixth question. Now I think, can anyone tell me by looking at this diagram? By looking at this diagram, what would be the most difficult question from the thorax can be asked? Yes, Bhima. What is the probable question can be asked? I think it is asked in June 2021. In June 2021, there was a question. So I'm not going to give you the answer. You need to answer what is this procedure known as? What is the probable main question can be asked? Yes, come on. Arvind, Bhima, Nagesh, Manish. Chalo, batao, what would be the question? Is it bronchopulmonary segment? No. Bronchopulmonary segment is also very important, but this is not related to this image. Don't know. Lumbar puncture? No. Lumbar puncture usually L3, L4. So L3, L4. What is that? Yes, come on, guys. Lumbar puncture? No, Bhima. So this is basically typical intercostal space. Okay. So the typical intercostal space. So the question, I think in one of the exam, the question was asked about describe typical intercostal space. Typical intercostal space definition. So the question can be asked about definition. Now boundaries. So what are the boundaries? Superiorly, inferiorly, anteriorly, posteriorly, and the contents. The contents explain where the needle is inserted in the intercostal space to drain pleural effusion. So this can be a clinical question. Clinical question can be asked. What is the anatomical basis of same? And name the structure which appears during this procedure. Okay, so this can be a question, especially typical intercostal space. So after the class, just go through the chaurashia, go through the typical intercostal space and go through the anatomical aspects. So this can be a bouncer in your exam. It is asked in June 2021. So last 5 years, if you see the CBMA paper, the most difficult paper is the June 2021. And in June 2021, one question was asked about that is the typical intercostal space, and the second question asked about the larynx. ठीक है, चलो next. Okay, so the next question, so all of you guys, so larynx. Larynx is the question. So or glottis can be a question. Okay, larynx. Larynx. So either larynx or pharynx. So can anyone tell me what is the structure visible there? What is the structure visible there? First year student, what is the structure visible there? So there is a structure, no? What is that basically? What is that? Come on, guys. Singer nodule, okay, singer nodule. Vocal cords, very good. Vocal cords, so supraglottis, glottis, infraglottis, and all. So very important question is larynx, very, very important. So how many of you read larynx in detail? How many of you read larynx in detail? Say yes or no in the chat box. Say yes or no in the chat box. Be very frank, guys, be very frank. So if you haven't read, just go through the larynx today. So after the class, Bhima read. Okay, Bhima, very good. Bhima has read. So Arvind, so Arvind आपको पढ़ना ही पड़ेगा. So you must read. Okay. So what are the adductors? What are the abductors? What are the tensors? What is the nerve supply and all? Very, very important. Rectal laryngeal now, superior laryngeal now. All these thyroid surgeries affect the laryngeal muscles, basically vocal cord, because of involvement of the recurrent and superior laryngeal now. So Sayan Mandal beta, so you must know. So just go through larynx, okay, half an hour, just go through the summary. So just prepare some notes, okay. Larynx तो आपको पढ़ना ही पड़ेगा. Fine. So this is about the question. चलो. Next question, next important question, larynx I said. So what you must know, the cavity, the actions of the intrinsic muscles, and nerve supply, and explain the anatomical basis of injuries to the nerve supplying larynx during thyroid surgery. So this is one more very important clinical question. So in case of thyroid surgery, so these nerves are affected. That's why this is frequently asked. Chalo. Can anyone tell me what is the only one abductor of vocal cord? Only abductor of vocal cord. Let's see who is going to answer. Only abductor of vocal cord. So this is simple MCQ. This can be asked. Shashank, Vachana Niranjan. So I said adductors and abductors of vocal cord. Only abductor of vocal cord which causes abduction. Rest all cause adduction. So this is adduction, guys. This is adduction. This is abduction. Abduction of the vocal cord. Question can be asked, only abductor. Yes, very good. Arvind answered. Very good. Arvind, beta, very, very good. You are great. Arvind. So Arvind answered. I'm going to write his name over the slide. Arvind, great answer. Good. Chalo, good. Chalo, next question. Posterior cricoarytenoid. Sorry, posterior cricothyroid. Good answer. Good. Chalo. Now next question. Can anyone guess what is the question can be asked by looking at this image? Come on, guys. Look at this image and probably what is the question can be asked as a main question in your upcoming exam. And it is asked in the recent exam. Last 5 years, this was repeated 2 times. Chalo, Pandu, okay, Pandu Tanai. Very good. So you can see there superior concha, middle concha, inferior concha, and the openings. So openings and all. So one very important question. So you must read is the lateral wall of the nose. Lateral wall of the nose. Very, very important. Very commonly asked. Lateral wall of the nose. Very important. Okay? And the openings and what are the structures draining into this concha and all. Okay, bulla ethmoidalis, that is the nasolacrimal duct. So middle meatus. Can anyone tell me maxillary sinus? What is the site of opening of maxillary sinus? Yes, come on guys. Maxillary sinus opens into. Can anyone tell me? Maxillary sinus. Shashank. Hi Shashank. Okay, Bhima आपको पढ़ना ही पड़ेगा. This is not the regular discussion class. This is just a 10-15 minutes class just to tell about all these are important, and just to give you an awareness that these are all question asked in the recent exam. Okay. Chalo, chalo. Shashank, okay, are you there? Hiatus similaris, okay. So, maxillary sinus. Simple, it's very simple it is, yes. So, it basically opens into middle meatus, right? Middle meatus. Good. So, the question can be asked like this. Describe the lateral wall of the nose. Lateral wall of the nose under the following heading. Lateral wall of the nose under the following heading. What are the headings? Features. Features. Blood supply, nerve supply, and applied anatomy. Applied anatomy you must write. Good. Applied anatomy and all, that's great. Yes, this is for RGUHS only. All these are repeated question in previous CBME paper. Previous CBME, all these are repeated. Okay, Nazba, yes, Bima, yes, good. Chalo. Next. Next question, I think the question can be asked. Can anyone guess what is the probable next question? So, a 2 or 3-year-old, a 4-year-old child with a coin there, you can see the child there and a coin there, child and a coin. So, you can see this is the coin, this is the child. So, there can be clinical scenario of foreign body entry into the some structure. So, what would be the main question probably? Bima. No, it is not intentional tremor. Intentional tremor, that okay, in cerebellum. Fine, you are right. So that is in cerebellar disease. You know, mnemonic is Danish. So dysdiadokinesia, nystagmus, ataxia, intentional tremor. So and all, you must be knowing that. So my question is the child and a coin there and a coin there, foreign body, choking. Yes, what would be the question can be asked? Lungs, very good. Lungs matlab, what would be the question? What would be the question? Very good. Arvind, so the question can be about bronchopulmonary segment. Bronchopulmonary segment. Bronchopulmonary segment, very, very important. Bronchopulmonary segment. So BPS. So BPS is very, very important, guys. They are asking this question in alternative year. So, one varsha idike heltare, one varsha adike heltare. So, bronchopulmonary segment, very, very important. Okay, so how many of you read properly? How many of you read properly about the bronchopulmonary segment on the right lung and the left lung and the clinical importance? Say yes or no frankly. Be very frank, guys. Be very frank. Yes. Bima, how many of you read? Yes, yes, okay. Cyan Mandal, good. Cyan Mandal, yes, good. I think good, good. So it's easy, right? It's easy. Okay, good. Chalo. This is how the question will come in exam, probably. A 2-year-old child, so 2-year-old child was brought to the emergency department with a history of swallowing some plastic bead. Plastic bead. I said it is a coin. So plastic bead, which is the likely bronchopulmonary segment lodging in this, that is the foreign body. Define bronchopulmonary segment. Mention the bronchopulmonary segments of both the lungs. So, and what are the relations of medial surface of left lung? So, here the question asked about the left lung. Left lung. Repeat question. Left lung. Left lung. Okay. So, bronchopulmonary segment and the medial surface of left and right lung, that is very important question and very commonly asked. Good. Yes, Shadi. Okay, good. Chal. Next question. So, now we are moving into the next question. So, I think this is question number 9 and the last question of the day, that is this question. So, can anyone tell me what is this condition probably? What is this condition? And what is the probable now they are going to ask you in exam? Claw hand, very good, claw hand. So the claw hand is very important question. Claw hand, that is the ulnar now. Ulnar now. So you must know the properly about ulnar now, properly about median now, okay, radial now. And in one of the exam, the question was asked about anterior introitious now. anterior introitious nerve, anterior introitious nerve, okay, anterior introitious nerve and the posterior introitious nerve. So the question can be asked, okay. So good, chalo. So ulnar now. So describe the ulnar now under the following heading: root value, course relation, branches and the applied anatomy. So this completes your all 10 questions. So tomorrow we are going to discuss 10 more important questions. So 20 important question. I think there will be at least few questions from this 20 in upcoming exam. So after the class, so after this session, just go through this 10 topics, very important topic. All are repeatedly asked in CBME, especially in RGUHS. All these are RGUHS repeat. RGUHS repeat. Okay, RGUHS repeat. Chalo. So this is even Bima. See, last year, last year RS6, RS6, RS5 and 6 around. It is 70% of repeats, around 50 to 70% of repeats. But because this year it basically the exam pattern has been changed. So yes, good. So that's it about the 10 important questions that is asked, that can be asked in your RGUHS exam. Okay, chalo. And also, there will be some ADCOM question as well. ADCOM topics, 5 marks, okay, around 5 to 6 marks can come from ADCOM topic. So this is some update, all of you. It was not there in last year. They introduced this in this year only. This year only. Okay. Chalo, this is okay. Okay, Vishal and Vishal. Perineum, that will come in anatomy paper 2, not in the paper 1. So this is okay. Any doubt you can ask me, guys? Any doubt related to your examination? Yes. I'll be there for next 5 minutes. 5 minutes. Definitely there will be PYQs. So there will be PYQs. Okay, embryology, most important topic. Okay. So I'll come up with some important questions. Okay, embryology, there are 10 important topics. If you ask me general embryology, so I'll tell you what are the question can be asked. Let's list out what are the important topics. So repeatedly asked in your exam. In general embryology. So general embryology. General embryology. So as you know, okay, important questions discussion. Okay, ADCOM question. Okay, Milanar. Okay, so I'll come up with that tomorrow. Just remind me in the group. I'll come up with the important ADCOM questions tomorrow. So embryology question. Let's see, Bima. So I think you can help me important questions. Okay, okay. Chalo, guys. Chalo, guys. Chalo. So one I think very commonly asked question is your spermatogenesis, embryo, that is oogenesis, very commonly asked. Okay, I'll write somewhere here. Okay. So one important question is spermatogenesis, very commonly asked. Spermatogenesis, repeatedly asked. And that is oogenesis. oogenesis, frequently asked. Okay. Then about the germ layers. Germ layers, very, very important. Ectoderm, endoderm, mesoderm, especially paraxial mesoderm, very important. Paraxial mesoderm. Paraxial mesoderm, very frequently asked question. Okay. Then comes is your, that is blastula, gastrulation, gastrula, blastula can be asked. Okay, that is gastrula, nothing but the formation of germ layers. Yes. Okay, Namita, yes, this the pattern is same for repeaters. See, as you know, the pattern is different for the new students or the new batch, and for old batch there is the old pattern. For new batch there is the new pattern. Okay, new pattern that is. Okay, chalo. So then question can be about the graphene follicle. So graphene follicle, notacard. So one more recently asked question is notacard. Notacard, derivatives of notacard. So, so there will be some. I think there is a PDF that I'll share with you after the class. So important topics in embryology, general embryology, and in systemic embryology, very important topic is midgut rotation. Midgut rotation, very commonly asked. Hmm? Chalo. So this is about the today's discussion. So we'll come up with some more important topics tomorrow. Hmm? ठीक है. Yes, can anyone summarize what are the important 10 topics, today's 10 topics we discussed today? Yes, Milan R. Milan? Milan? Beta Vishal, we are discussing anatomy paper 1. So the perineum, anal canal and all will come in the paper 2. Okay. Vishal, good. Vishal, good. Yes, Goldie, I'll answer you, don't worry. Okay, general anatomy, good. Okay, some student asked me, so what are the important questions in general anatomy? Okay, so I think there will be 5 important questions as per my knowledge. So one is the yes, so general anatomy, right? So general anatomy. So general anatomy, one frequently asked question is type of epiphysis. Last year question, type of epiphysis. Frequently asked question, type of epiphysis, types of joint, types of cartilaginous joint, primary and secondary. Can anyone tell me what type of epiphysis is Corakad process? Corakad process. Let's see who is going to answer. Coraccard process. What is the type of epiphysis? What is the type of epiphysis? Last year question. Types of joint, that is we discussed. Then bone, the histology of bone, that will come in histology as well. So yes, very good, excellent answer. Blood supply of long bone. Yes, Shashank Pujar. So one more question is blood supply of long bone. Blood supply of long bone. Long bone. Long bone. Good. Shashank Pujar. So Shashank Pujar. Any question to remember? Long bone, yes, good. Epiphysis, joint, I said. Yes, loss of ossification. Good, Sandesh. Loss of ossification. Loss of ossification. Loss of ossification. Very frequently asked question. So very frequently asked question is loss of ossification. Good. Any other question? Hilton's law. Yes, Hilton's law is a repeat question. Hilton's law. Hilton line is also question in paper 2. Hilton line and pectinate line is in paper 2. Good. So type of epiphysis, very important. Type of joints, loss of ossification, blood supply of long bone, and the loss of ossifications. So very important questions. So from the general anatomy, I think 5 to 6 mark in your paper 1. Paper 1. Chalo, ठीक है. So important questions in neuroanatomy. Beta, important questions repeatedly asked is your, so that is cerebellum. Cerebellum is very important, very commonly asked in the exam. Pakka question. Okay, cerebellum. So then next comes is your the the oculomotor nerve, that one can be asked. Facial nerve can be asked. Okay, that we'll discuss tomorrow. Decussation, yes, very good. So that is the label diagram of the brain at the sensory decussation, at the level of superior colliculus, at the level of inferior colliculus. Okay, good. So good. So functional area rarely, I think in physiology they asked, in one exam they asked about the Broca's area. So what is the area of speech? That is the Broca's area in physiology, not in anatomy. So and as usual question, the lobes, frontal lobe is very commonly asked, frontal lobe. So that we'll discuss tomorrow, some more important questions. Yes, modifications of dysphagia. Yes, I think who answered? Vinay, good answer. So Vinay said, sir, modifications of dysphagia. Good answer, good question. Asked almost twice in exam. Dysphagia. Good. Dysphagia. And modified cervical fascia. Very good. Modified cervical fascia. So Girish, already we discussed some important questions, 5 important questions. So embryology discussed already. So rule of 2, basically that is a Meckel's diverticulum. So Meckel's diverticulum. Good. Chalo. Anything else you want to ask, you can ask me. I'll be there for next 5-10 minutes. 5-10 minutes, guys. Come on. So tomorrow we'll come up with some more 10 questions, important 10 questions. So and let's discuss about the time management also. So time management. Okay, as you know, for new batch, so new batch, so there will be one long essay. So one long essay, so that is around 10 mark, and there will be 11 short essay. That means it is 5 into 11 become 55, and this is 10. And there will be reasoning question. So reasoning questions. that is 3 into 5, that is 15, and MCQs, and there will be MCQs, so around 20, that means total 100. So this is the pattern, right? This is the pattern, right, Shashank Pujar? This is the pattern for new batch, right? Yes, Vinay, yes, Saina will join and all. Yes, beta, good. So it's a good answer. Good. So now time management. Can anyone tell me how to manage the time? That is very important. So managing time is very important. As you know, 3 hours you need to complete all these questions. Yes, Shashank. Shashank is telling sir 20 minutes for MCQ. Okay. So MCQs 20 minutes. Agree with that. So as you know, 20 MCQs and there will be 10 clinical scenario. 10 clinical scenario. 10 clinical scenario. So there will be 1 clinical scenario and 2 MCQs. So 1 clinical scenario and 2 MCQs. So 20 minutes I think for MCQ. Okay. Syed Abdul. So what is your opinion about the reasoning question? How much time is needed to write 5 reasoning question as per your knowledge? So Sayan Mandal, triangle of necks very important, especially anti-triangles very important. Anti-triangle, both are important. Both are asked in the exam. So triangles of neck is important. Okay. Okay. Syed Abdul is telling sir around 20 minutes. Okay, 20 minutes for this. Okay, that's fine. Long essay. How much time is required to write long essay? Long essay. Chalo, come on, guys. Come on. 20 minutes. Okay, 20 minutes is reasonable. And Shashank is telling 30 minutes. My question, long essay. Long essay ಎಷ್ಟು ಬೇಕಾಗಬಹುದು? So Goldie is telling 40 minutes. So Goldie is writing some other exam, I think. Goldie, don't worry. So Goldie, so I think my knowledge, the maximum 30 minutes. 30 minutes. So 30 plus 20, 50. Okay, 50 and 20. That means it is around 1 hour 10 minutes, right? Almost 1 hour 10 minutes. So for short essay, there are 11 short essays are there. So 11 short essay. So you need to write in around not 100 minutes. It's around almost 30 minutes. Okay, 30. So how much is left behind for a short essay then? Short essay ಎಷ್ಟು ಉಳಿಯುತ್ತೆ ಇವಾಗ? So 20, 40 minutes, 1 hour 10 minutes. Now we have 1 hour 50 minutes. So 1 hour and 50 minutes. So that means it's around 10 minutes. 10 minutes for each question. Okay, short essay I need to complete within 10 minutes. So 10 minutes for each question. 10 minutes. Okay, Medicore. Okay, 1 hour 50 minutes means what? It is around 110 minutes. 110 divided by 11. That means it is around 10 minutes. So this is again approximate values. Approximate values. Yes, good. So this is how you can plan, guys. So time management is very important. Yes, how is the preparation? Syed Abdul Rahman. Syed Abdul Rahman, how is the preparation? Okay, ATCAM question tomorrow I will cover. You don't worry. You just remind me tomorrow I'll cover ATCAM question. So briefly about ATCAM questions. Okay, I am going to discuss tomorrow. So nice. Okay, good. Syed, good. There are few offline students from our institute. Okay, here, there. Okay. So good. Chalo. This is about the today's session. All of you, thank you all, and study well, and don't take any stress. So just read, revise. Okay, read, revise. So revision is very important, guys. So revision is very important, and practice some common diagrams. So practice some common diagrams. Like example, the venous drainage of the heart, blood supply of heart, you can prepare one common diagram. Okay, so yes, Milan, okay, that's fine. I'm fine, Milan. I'm fine, I'm very well. So just to summarize all of you, the long essay should be completed within 30 minutes. 30 minutes. So 9 o'clock exam start ಆಗುತ್ತೆ 9:30ಗೆ ಒಂದು ಲಾಂಗ್ ಎಸ್ಸೆ ಮುಗಿಬೇಕು ನಿಮ್ಮದು ಅಲ್ವಾ. ಸೊ ದೆನ್ ಯು ಕ್ಯಾನ್ ಸ್ಟಾರ್ಟ್ short essay or short answers or MCQs depending upon you. So 10 minutes for each short essay, not more than 10 minutes, not more than 10 minutes. So for one short essay 10 minutes, reasoning question 5 question, and around 3 to 4 minutes, around 3 minutes, and MCQ 2 minutes per question. That is the one clinical scenario, that means 2 minutes for each question, that is okay. So that's it about the today's session, all of you. Thank you all, good night, study well, you don't sleep now.